Rock the Rescue is our annual event, which is a joint venture between ourselves and local EMS and air care providers here in the area.
Rock the Rescue is a program that we developed through Trauma Services that encompasses EMS education and community outreach at the same event. What we're doing here today is live simulation for EMS education on the water and tourniquet and wound packing education for the community on the deck.
We're the owner of Tim's at Lake Anna. Anything that comes at us that's community-based, something where we think we can do some good, we're all over.
Because if this one tourniquet does not stop the bleed, you can put a second one on her.
Stop the Bleed is about an hour-long education for members of the community who don't have medical experience. I like to say it's for the immediate responder while they wait on the first responder.
Especially in the rural areas like ours in Orange County, you know, we're a long ways from hospitals. So having any citizen know how to stop the bleed, which is the #1 killer of trauma patients, is really important to us.
The longer the patient bleeds, the harder it is for us at the trauma center to get that patient recovered. So in cases of bombings or shootings where there is massive bleeding, if the patient comes to us and they don't have any circulating blood left, there's not much we can do. So it is so important for the community and that immediate responder to be able to control that bleeding. It gives us a better chance to save that patient when they get to us.
I'm married to an RN, which means if we're going down the road, come upon an accident, she has a duty to respond. I want to know how I can help while I'm there.
I'm an RN in the hospital. I'm not an RN on the rescue squad. It's a big difference. So I want to know, what do I need to know before they get to the hospital?
The first responder is not the person with the EMS certificate, it's the person at the bedside or at the site of injury, which is usually family or friends. So the point of this is to educate the layperson on what bleeding is, how to address, diagnose or find, and also stop. It's life-saving.
Rock the Rescue is a wonderful opportunity for us to engage with both the community and our EMS partners. We sponsor EMS Night Out throughout the year, and it's a training event where EMS providers can get training, have training by some of our staff at the hospital or others in the community.
We're going to simulate a boat accident. We're going to have a pontoon boat that is going to have hit the bridge. We're going to have a severe injury as a result of that collision. We're going to have some boats here. They're going to rescue the person out of the water and then bring them to shore. Every opportunity we have to practice this, these evolutions in the water, kind of in a live situation, helps our providers for when we have to do it for real.
All right, well, we're going to get you transferred up to the stretcher and get you into the hospital, okay?
One of the biggest things is definitely training and preparedness. It helps our crews prepare and interface with what they're going to be called to do, but also, I think most importantly, it gets us interface with the public so the public can understand what happens behind the scenes with what we're going to do when we arrive.
Most of the time, people see us running up and down the roads, lights and sirens. They don't really realize what goes on, other than that when they call 911 and they need help, we show up. This kind of gives them a little behind the scenes of what actually happens.
We work a lot with like Spotsylvania County, Orange County, Caroline County, King George. So it's really important that we all come together, learn something from each other. We love our community, we love meeting new people, so this is awesome.
Mary Washington Healthcare was great, bringing us all together to get this event going.
My brother had an accident with a firearm where he required life-saving treatment with a tourniquet, and my mother did not know what to do, so she suffers from PTSD from that. And so we thought that if we could bring this to the community so that one less person would have to suffer from the PTSD from not knowing what to do for their family member, then we've done our job. And we've definitely done our job. We've taught over 3,000 people in the community.
It's an important issue. It's an issue that folks have dealt with at times, folks have learned from, and everyone at this point, from what I can interpret and what I see, are impressed and are confident now that they've left from this with some knowledge that they can make a difference.
Good job, yes!